My name is Suzanne Patterson. I'm a graduate of a 3,000-hour RMT program. I've been an RMT for 8 years, and we're going to go over some draping for pregnancy. So, things to know for pregnancy, just making sure that the client is always comfortable. Communicate with your draping before you actually do the draping, and always ask if they feel secure and snug in the draping before proceeding to treatment. So I'm going to show you first how to drape just the back without risk of exposing the chest or the buttock, okay? So first, what you want to make sure is that your sheet, you have enough sheet that actually covers their head. And you explain to them we're going to undrape your back. And I'll ask you a few directions, so just comply with that. And we're going to expose the back. Are you okay with that? Perfect. So first, if you're using a blanket, just get the blanket right out of the way. If they're wearing underwear or not, you want to have an anchor so that the sheet doesn't expose anything. So if they are wearing underwear, you can feel for that and actually just tuck in a little bit. And then I like to do an extra tuck just right underneath the gluteal, so that we know that the sheet isn't going to move around anywhere because we have an anchor. The second step is to find your edge and your corner. So we need to expose the back. So our next direction to our client is to ask them to raise their head or raise their hand above their head. And so you're going to basically use that as a guideline as to where you're going to put the drape. Okay? So we are exposing the back. So we need a little bit more sheet. And then I'm going to ask her to just lift her head and place that right underneath the neck. Okay, and you can place your arm back down. And at this point, this is where I would actually place her a hug pillow so that she feels safe and secure and actually comfortable in the front. And then you can proceed to roll the sheet, pulling up if you need a little bit more slack, and draping into the underwear like this. So now you have full access of the back to treat the back inside lying. You can also, this also gives you great access because she's tight and secure in the side, because the drape is tight around her neck. You can actually have mobility to use the arm to stretch out the lats as well. This is great. You don't even have to be pregnant. This is a great technique to use on anyone that you want to stretch the lats or the rotator cuff. It's actually a great way to also work on the neck, because you can get right into the side and they're completely comfortable. Like this. So another option in side lying, they don't have to be pregnant. It's a great way to use the ProStim blade, supporting the arm and just stripping all the way down through the side here. Once we have the client's back draped, we can use the ProStim TriStar to treat the erectors down the spine, like so. You can also use it to treat the QL, to get in a little bit deeper and through here. Always checking in with your client for pressure. So this is how we get out of draping the back. First, you're going to untuck from the underwear or from the glute to try to cover up as much of the back as we possibly can, okay? Using the blanket as well. Then basically you're going to take the top sheet, finding your line, and just slowly pull that out. Now we have our corner, and we can pull that up and over. And if she likes, she can place her arm back underneath. And she's all covered up now. So you're ready to move on to the leg. To drape in side lying to treat the glute or the hamstring and the quadricep, whether they're pregnant or not, it's a great position to be able to access these structures. So first, what we're going to do is we're going to place a pillow under their knee so that they're comfortable. So you just grab the edge of the sheet and you let them know that you'll be passing a pillow towards their knee, and you ask them to grab the pillow. Sorry. There you go. And you can just place that in between your knees so that you're comfortable, okay? The second part that I want to make sure that you have ready is a towel. Okay, so just a regular size towel. And then to drape, if you have a blanket, I want you to just get the blanket out of the way by covering the upper portion of the body. Okay. When you are working the lower leg, only exposed to the knee, again keeping in mind your edge and your corner, support the knee, grab your edge, and ask your client to reach down underneath the sheet and grab that corner for them to be able to pull that up a little bit. And that's great, and you can relax. Okay, relax the leg. At this point, you will move the blanket up a little bit higher and place the towel down. The towel is to cover the front of the body so that there's no holes or gaps anywhere. And again, you want to take the edge of the towel and line it up from hip to knee so that it's almost on an angle. Once we're at this point, you can come around to the back side of the client. So you're going to want to take your edge and slowly move that edge all the way back to expose the glute. If they're wearing underwear, you can tuck into the underwear. If not, you just want to move it up, and you can use the towel to tuck in the sheet. At this point, the towel is still along the leg. You'll come around to the front, support the knee, and just pull the edge of that towel through so that they are secure in the front as well as the back. Does that feel snug and secure? Perfect. So at this point, you have great access to the quadricep muscle as well as the hamstring, glute med and TFL, and you can work around to the back side of the glute as well. So also taking your Pro Stim blade, you can strip the leg in through the quad like this, come around to the back of the hamstring, or you can choke up to the blade here and get in to be a little bit more specific. Always checking in for pressure. Once the treatment is done, to get out of the draping without exposing anything, I like to take the towel edge out first. So you'll just slide that out. And we want to recover the leg with the towel just how we started before. Once that towel is covering the leg, we know there's no risk for exposure. Then you want to pull down the sheet from the glute to cover the leg. At this point, if the client is still holding on to the sheet underneath, you can ask them to let go, and you basically just pull the sheet out, keeping an anchor on the sheet here so that nothing is going to come out of place, and pull that down. So that now that you have the sheet completely covered, it's okay to remove the towel and place the blanket back over the client. If you are fortunate enough to have a pregnancy pillow, it's a great device to make pregnant women feel a lot more comfortable on the table. And it's a lot easier on the RMT. Side lying, you can be in awkward positions trying to like stretch out and work the back. And this actually allows the client to be face down so that you can treat them just as normal. Okay, so I'll explain a little bit about the pillow. So it has Velcro in the middle, so you can actually adjust for the size of the client depending on how far along they are. If you have it closed, it still has a spot for the belly to go, okay? If they are further along, you can actually open the pillow up and create a lot bigger space with them aiming to put their hips on the two support beams right here, okay? So when you make up the table for the pillow, make sure that the bottom sheet has a little bit extra material so that you can actually create a little divot in the sheet so that when they place their belly down, they're not meeting resistance on a sheet like this. Okay, we need to create space for that. So just put a nice little crevice in there, and then it's a lot easier for them. So while treating pregnant women, you might find that they have to leave in the middle of the treatment to go to the bathroom. So to get them back onto the table when they come into the room, I'm just going to show you how you can turn the sheets appropriately and help them back onto the table. Our lovely lady here is 8 months pregnant, so it's just going to take a few minutes to get onto the table. So come on in. And again, I would just get you to place your knees just on the table here, and you can just help them to get the sheet out of the way so that they're not kneeling on the sheet. Okay. Okay. So now the sheets are the wrong way because they need to be vertical, but right now they're laying horizontal. So we just need to untuck in all the places that are kind of stuck underneath her. Okay. And again, a good idea to find your edges. And just start rotating the sheet. Just working our way around the table to make sure that we are finding ourselves back from where we began. Again, finding the corner of the sheet, lay that down, corners of the sheet, and then we will come up to the top. And you can continue with treatment now that they've come back onto the table. Now that we have our client laying face down in the pregnancy pillow, you're probably wondering how to actually turn them into supine and remove the pregnancy pillow out of the way so that you can continue to treat face up. So what I like to do is take the bottom sheet and explain to your client that you're going to take a toga style draping and wrap it around their neck so that their body is going to be covered. So you take both edges, wrap around the neck, make sure that the top sheet is draped over top, okay, and then explain, now that you've got this toga style around the neck, you want their hands to come out and actually place them on the table. So you have to come back, yeah, through there, perfect, on both sides, and they'll be covered up the entire time. And explain, once they are on their hands and knees, I will be pulling the pregnancy pillow out from the front and then allowing her to stay on her hands and knees and then turn over. So we'll go ahead and do that. So you can push up onto your hands and knees. Okay, and just stay like that. And you're keeping this tight so that the front is completely not exposed. You will then take the handle of the pregnancy pillow, pull that out. Now we're on our hands and knees and we've got the toga around the neck. You want to come behind the client because you will now be placing this back on the table. So long as you are behind the client, there is no opportunity for me to see anything that I'm not supposed to see. And you're going to explain, I'm going to lay the sheet back down. You can help me lay that out and just drop that. And now I'm going to be using the top sheet as a privacy curtain to allow them to lay onto their back. So just as before, we create the privacy curtain. You ask the client to let them know, or let me know once she's turned over, and you'll place the sheet right back down on top of her.
And turned over.
So she's ready to go. It's okay that we've covered her face just in case she didn't get the cue to move down. Again, hold the sheet and the shoulder to move that down. And that's how you would turn them supine. In this position, you want to take another pillow. Ask the client to roll away from you, and you're going to grab the bottom sheet and just place that over top of their belly and tuck in the pillow underneath their right hip. So placing the pillow underneath the right side of the hip, we'll push the baby over to the left, taking the pressure off of the inferior vena cava.